So when we look at mental health policy, we look at the guidelines, the frameworks, the laws that have been put in place to make sure mental health is addressed in a proper way. To be precise, I think we still have an awareness problem or challenge as the mental fraternity. Very few people are willing to take on the challenge of looking after the mentally sick or addressing the challenges that the mental health industry is facing. One of the efforts now underway by government is to make sure, actually it's a policy being worked on, is to make sure mental health integration is done at the lower centers of care, which includes the health center, 4s, 3s,
2s.
Yes. Why we are advocating for integration is that most of these cases can be arrested early. And also, if we have people more knowledgeable about mental health, there is the whole referral thing, because there will be identification, early screening, and then treatment interventions are very many that and may not necessarily need hospitalization. So seek out for help, because it will not go away just because you've decided to hide. It won't go away. Instead, it will lower your quality of living and then your chances of living better. We still have a long way to go, but at least we are not where I used to be. So with that, we call upon people in different capacities, from leaders to employers, to school heads, to anyone in the capacity of leadership and influence, to join efforts to make sure that wherever they are, whatever places that they have influence over, that mental health is prioritized, because it's real, it's here, and it needs the urgency that it deserves. Otherwise, it's going to deter a lot of development, and so many people will be affected in the long run, but also our country at large.
Welcome to It's All Mental podcast, where we discuss mental health related challenges and the things that affect us on a daily. And with us today, we want to talk about the good policies that make mental health services more affordable, more available, and more sustainable. And with us today, we have someone who has an experience in all this, and she's going to share with us what are some of those things that can avail us with the better services in regards to mental health. And she's called Nusula Nakato, and she has quite an experience, and she's going to share with us for how long has she been doing this, and things that have to do with mental health. Why did she even choose mental health? Nusula, you're most welcome to the podcast.
Thank you, Asiat. I'm happy to be here on the It's All Mental podcast. I've been in the field for 10 years now, made 10 years last year. Background-wise, I'm both a public health specialist and a psychiatric clinical officer. I first did my training in clinical psychiatry in Botanica for 3 years. Then I went on to do public health and all. I've worked in different settings, from clinical work in Botanica to community liaison in the community to community education, and then I started to have experience. I did some of that in the UK, and then I came back here, and now, by the grace of God, I serve with the Uganda Parliamentary Forum on mental health, on matters mostly to do with policy, advocacy, and supporting mental health programs from the different partners we work with. Yeah.
Okay, so that is quite a good background, and I think you're the right person to talk about policy. So we are really glad to have you here, and
Thank you.
The people who are going to be listening to us, I believe they're going to be able to learn one or two things when it comes to policy. For you who is now working in policy, and to someone who is watching us, they don't know anything about policy. What is even policy?
Maybe I should start from mental health for perspective.
Yes.
Mental health, briefly, it's like we all know, okay, for those that know, that mental health is not just a static thing. It's our general state of well-being, just like World Health Organization defines it. It's a state of well-being where we do not look at one state. We look at both the physical, the psychological, the social, and other aspects of well-being. So for it to be a good state, it has all those other states have to be in sync, and it has to be in a good place. But also when we're talking about mental health, we look at individual, that this individual has to be able to deal with the day-to-day life, the stress of life, to be able to work, but also to contribute to the communities where they live or work. So that is what we call mental health. However, mental health is not, like we've said, it's not static. Something can happen to someone who was mental okay, and then they drift to the other side of it, which is literally the ill mental health. So yeah, when it comes to policy, before we go to mental health policy, when we talk about policy, we look at maybe a set of laws or guidelines or a framework that has been decided on by government to make sure it addresses a particular thing or goal. But in this case, we are looking at mental health. So when we look at mental health policy, we look at the guidelines, the frameworks, the laws that have been put in place to make sure mental health is addressed in a proper way. To make sure, and addressing it involves different things. There is promoting it, there is preventing ill mental health, there is supporting the mental health programs, there is allocating funds, finance, there is, protecting the people who are already living with it in dignity, but also to respect their own rights, because we live with these people in the society. So policy involves all of that. And for this case that we are talking about mental health policy, especially in Uganda, we are looking at policies that are that can be able to support all that included in regards to mental health.
Okay.
Yeah.
So I think the person who's watching us now knows about policy.
Yeah,
even me, I'm learning one or two things.
Yeah.
So now, with the fact that you're working at with the Parliamentary Forum on mental health, I want to find out what are some of the mental health related challenges that you have been seeing that the Ugandans really are having or facing currently.
The challenges are still quite many, but to be precise, I think we still have an awareness problem or challenge as the mental health fraternity. But I think from our perspective as the forum, that's why one of our mandates is to make sure the advocacy policy that involves awareness programs are championed to make sure people have the right information as far as mental health is concerned, that there is proper mental health literacy within the communities, from the places of work to schools to institutions of learning to the general community, that people know what mental health is so that they can be able to help those living with it and also be able to prevent it for those that have not yet gotten into it. That is one challenge. Then the other challenge has been financing. Mental health, we are glad that now it's has started receiving the recognition, and efforts to beef up on the financing are underway, but that has been a challenge in the past, financing mental health efforts to make sure it's given priority. The other challenge would be putting the already existing laws in action. Actually, the recently concluded mental health awareness camp that we held at Parliament. Yes, that was our theme. That how can we be able to make sure policies put into action, the policies that already exist are put into action, and we were glad to be graced by so many honorable members of parliament, including the right honorable speaker, and they're on board to make sure that the right efforts are taken on. So yeah, I think for the most challenges, and then the other one, not to forget, is the professional capacity. We still have few professionals on board, given the population, the growing population, the capacity of the professions to address these challenges is still low. So there are efforts underway by ministry and public service to make sure more mental health professionals are absorbed in the system to beef up the supports.
With the recent person that we hosted here, we were still talking about that issue. We are having a few professionals. Right now, you people who are working at the forum, what are some of the things that you are seeing to do that with the big number of Ugandans who are also facing these challenges, what can we do in order to see that the number of professionals is really increasing as compared to the population that we are serving?
I think, as a professional who has been around for some time at least, I think that challenge stems right from, I think, the stigma around it. Very few people are willing to take on the challenge of looking after the mentally sick or addressing the challenges that the mental health industry is facing. So the shortage that is there is being addressed, because now there are different programs coming that are aimed to mental health, like apart from the recent past where we had only a diploma in mental health and maybe nursing, both at certificate and diploma, but there are other, we have quite a number of psychiatrists coming on board. We used to have very, very few. 10 years ago, there were very few psychiatrists, but now the number is almost hitting 100, which is a good thing. But also we are seeing efforts in making sure these other cadres are given mental health trainings to be able to support on that team that is already existing. Otherwise, if we are to go with only the professionals that we have on board, they cannot counteract the problem. So those efforts are being done by government mostly, but also other organizations, to make sure that the workforce is beefed up by these people being given mental health trainings to help out.
Okay, that was also going to bring me to the next question that you have already mentioned. You talked about, trying to beef up the people who are working at the health centers.
Yes.
So I was looking at how can we be in position to, reach out to these health centers and see that first line of care, from the primary health care, people are getting mental health support at the different health centers where they are
actually
being made.
Thank you so much for that question. It has reminded me that one of the efforts now underway by government is to make sure, actually it's a policy being worked on, is to make sure mental health integration is done at the lower centers of care, which includes the health center, 4s, 3s,
2s.
Yes, because we discovered that, first of all, we have only one national mental health referral, and it's now more than full to capacity. So in the way of making sure we decongest the main points of care, including the national mental referral, we are looking, one of the efforts of the policy that's being worked on or being put efforts towards is integration of mental health down at the health centers, to make sure that we have qualified staff there that can screen people right from the entry levels of care, so that when there is early screening, there is early intervention that can be done, so that people do not reach into crisis and they need to be hospitalized, of which the hospitalized institutions services are very limited. Yes. When
it comes to things that have to do with mental health, we have seen the support coming in from the donors.
Yes.
Especially when it comes to Uganda. So from that aspect, how do you see sustainability being there in regards to us seeing that the donor funding right now is really being cut off, and that really people are struggling to see that these organizations are still standing, these organizations like NGOs that are trying to support the government to see that mental health support is really given to the people of Uganda? What kind of sustainable things do you think the government can put in place to see that really with this cutting of the donor funding in Uganda, really support is still being given to the Ugandans who are seeking for it?
We all know that the funding infrastructure right now, or the ecosystem of funding, has been distorted by what we all know that has been taking place.
Yes.
And now most countries, including Uganda, they are looking at being like owning their health system, especially when it comes to financing, because they saw that it's not a sustainable model to depend on. Anything can happen. So in efforts to do with how can we make sure that there is sustainability even without donor funding. So that's why we are now championing community care. right from the VHTs, are these people able to support people from the lowest level in the community, from family level actually, from family level? Because if someone has support from family level, community, and then the lowest health center, which is nearby them, chances are high that we are going to see few people and conditions escalating to the highest level of care, and also little of the burden to the finances that we have limited already. So what we are proposing as people who are as professionals already in the field who are working towards some of these, influencing some of these policies, is like we are saying, much as we are championing towards engagement, like community care from institutional care, but also our efforts are still on the integration, because integration will make sure that someone can receive care from where they are and they will not be able to go into a crisis. For example, if someone is maybe they are starting to use a drug and they are noticed from the family, that means the person will not go into addiction. The case will be arrested early, and then that will not put a burden on government to put that person in rehabilitation in Butabika or any other regional referral that has more specialized institution care. Yes.
Yeah, I like the feel of that. I think we are moving somewhere.
Yeah, sure.
Okay, for the fact that many of us are spending most of our time at work, at school, how are the people in those, places where we spend most of our time? What are some of the things that you think that right now they can be able to do in regards to the teachers, the employers? Where are these children and the people who work spend most of their time?
Yeah.
In order to support mental health services.
Actually, that's a good question. And I think before I forget, I want to really commend the Ministry of Education. It's doing quite some good efforts as far as institutions of learning are concerned and mental health. They are doing so many efforts to make sure that mental health is integrated into the education system.
Because recently they signed the guidelines.
Yeah. Yes. So the guidelines actually is one of the efforts they have really put themselves into, and they have actually done quite so well to make sure that the educators, especially in primary and high school, the educators have knowledge of mental health. They can be able to give first aid, but also they can be able to spot a child who is maybe battling a mental health condition, which was not the case before. So that, because these kids spend most of their time at school, so if their place where they spend most time and they cannot get any kind of care, then that will already put a whole strain on the health system that is already being burdened with the numbers. So as far as institutions of learning, there are efforts that have been put in place by Ministry of Education together with other stakeholders and other ministries like education and gender, like health and gender. They are working together, but also even as because before they pass these, that okay, we want to include the educators, we want to give a training to the educators, we want to make sure that the counselors at these schools are given the right information, or even their trainings upgraded to be able to manage some of these conditions before they can refer the kids for further management. So those are efforts in education.
But I've also seen that currently the ministry is also distributing IEC materials to support the children, to get to understand more about mental health.
Literature.
But, yes, but also I've seen the handbooks.
Yeah.
Yes.
Yeah, for educators.
Yes. So
and they're very nice.
They get to understand more about mental health and all that. Yeah. Yes. So that they can support the learning.
I actually like that, because they realize that the biggest barrier is in these people don't have the education that needs to help out, but also the right information. And I liked that. I have a copy of the handbook.
I also have one.
And the literature is very simple, that even an ordinary teacher in a primary school somewhere can read it and be able to get something. How to give psychological first aid, how do you notice early signs, how can you intervene, and where the points of referrals are. So that's a good effort.
And in terms of referral, I have seen things talk about the referral. So what are some of the things that we can be in position to improve when it comes to referral? Because we have seen cases in our communities, but people even don't know whom to contact, whom to send these individuals, even they don't know these signs. In terms of how can we improve our referral pathway when it comes to mental health services?
Okay, when it comes to referral, for example, let me just give an example of a school. Maybe a school in Masaka. They've noticed a child has addiction, for example, Usually, the referral would be like, okay, take that person because addiction is already, that's a mental disorder, a brain disorder that needs specialized care. So in that case, a person needs to see a special health care. In this case, if it's not a psychiatric clinical officer or a psychiatrist, because they need to be assessed, they need to be put on treatment, they need institutionalized care. But in most cases, we see that most of these regions have regional referrals, and most of the specialized care started before it started at Health Center 4. That's where you could only find a PCO. But now there are efforts to be that even these other places, other lower health centers have specialized treatment. Like a person can go there and actually be assessed and get specialized treatment. But in cases, because we are not yet there, but at least most regional referrals do not have PCOs, they have a mental health unit where someone can actually receive proper assessment and treatment. And in any case where it needs a regional referral kind of care, they'll refer to Butabika. But with the numbers in Butabika, we are advocating that people can be able to receive the care they need at the lowest point of care where they live. But you talked about for example, in the community, why we are advocating for integration is that most of these cases can be arrested early. And also, if we have people more knowledgeable about mental health, there is the whole referral thing, because there will be identification, early screening, and then treatment interventions are very many and may not necessarily need hospitalization. Yeah.
Right from the VHT that you mentioned, yes, going to the health worker at the health center, yes, 2, 3,
even 4. The primary health care workers, like, as long as they are given their capacity building in mental health, they can be able to handle. And maybe the treatment, for example, those that are not allowed to prescribe, they can just refer for prescription and then manage other things at their levels.
Okay.
Yeah.
So right now, for the things that you have been able to see, since now you're a program officer, there are quite a number of things that you have seen.
Yeah.
While interacting with quite a number of organizations, not even only just organizations, but also the other arms of government that are supporting mental health. What are some of the things that have been eye-catching for you in regards to mental health, and the things that you feel like the leaders that are out there can be able to, support when it comes to mental health support?
Okay, that's a tricky one. That I'll point out a few things.
Okay.
Given, like, we've already talked about the dynamics in the funding ecosystem, that has really been a challenge to mental health. Most of the big players we had that were helping the Ministry of Health as far as mental health is concerned, they faced challenges because of funding. So at a certain point, the burden had become bigger than before, because there was no support coming in from external help, from external, donors, the organizations that were supporting. For example, in refugee settlements, there was a whole crisis. Even in schools, actually, government proposed that we should have a specialized mental health person in every school. And I just pray that effort is realized soon, because we will have most of our population, like we know,
it's young
people, and most of these people are in schools. So if we can have at least a mental health professional in the schools, that will really cut on the cost of financing that is needed, because they will receive care right where they are, and only a few maybe cases that can be referred for institutional care. But to go back to what I have seen in the ecosystem, in the industry, and what I would want really leaders to pay attention. I've been privileged to work with different leaders in different capacities, and most of my outcry to these leaders is that now mental health is no longer like a normal medical issue. It's now a development issue, because if we do not pay attention to mental health as far as financing is concerned, as a country, we will all suffer. We've witnessed this so many number of times. There is a recent case here where a man went to our kindergarten and then just literally made just 4 innocent kids lose lives. And it's not until we do not want people to just come out during crisis alone. Because in mental health, before a crisis comes on board, there is so much that has happened. So you could see, like, you do not know, like, the lives of those kids was just put to zero in no minute. Why? You saw that even the president ordered the court to be in community, because they really wanted to touch base, wanted people to understand
what was going on.
Yes, the gravity of what is before the sin even occurred. So, and this person, from what the lawyers were reading out and all of that, the person had been in Butarika for some time, and most likely the person allegedly maybe was a mental illness candidate who was out of care and so many of those other things. So you see that from being one person, it affected the entire community, and before we know, the entire country was in shock. And so much was at stake out of just one person not being
supported.
Right.
Mm-hmm.
So mental health is no longer something like a medical issue like malaria. It is a thing that concerns all of us. That's one thing I want leaders to know, that whether you want to be concerned or not, at some point it will come to your door. So that's why we need collective efforts for people to come on board and champion the cause together, because together we can do so much. So the other thing I would really want leaders to know, that much as the numbers of professionals in the country is still low, we can still help the numbers that we have to be absorbed in the system. I know Ministry of Public Service is doing that together with Ministry of Health, and Dr. Diana. She passed out a recent document that was enforcing that more mental health professionals are absorbed in the public service, which was quite a very big step for us in the industry, because when we do not have those professionals there to serve, we will have so many instances like that one, because these people will not have anyone. The limited resources will not be enough for them, and the problem will come into the community. Before we know, it will be on our doorsteps, and all of us will suffer. Imagine those kids that lost lives just like that. So mental health is more than just any other issue. It's now part of and I am glad the recent report that came out, the National Population Report of 2025, the one that was read recently, early in the year, by the former Minister of Health, Dr. Ruth, it stated that mental health is a silent emergency. Whether we want to look the other side or not, it's an emergency that is here, and it's here for all of us, for the entire population. So it's just prudent that whatever leader in your capacity, wherever you are, to see that when efforts to champion mental health come to your table, you give them ultimate attention that it deserves, because if it's not going to affect you, to affect your child, it will affect a relative, it will affect someone in the community where you stay. It's a big cycle. It's a whole cycle and an ecosystem that includes all of us.
Okay.
Yeah,
that's quite interesting. So I think the leaders are listening in.
Yeah.
And also to the people that are viewing us right now, people who are challenged with these mental health challenges, from someone, because they're hearing you are talking about policies that concern them. What are some of the things that you think that they can be in position to do in regards to seek the right support? And where can they really get this support when it comes to seeking for it? Because we are talking about it, we are encouraging them, but where can they get it from?
For anyone living with a mental illness, Maybe let me start from there. First of all, I want them to know that it's okay, because most of them either run out of care or they fear to seek help because they think it's, first of all, yes, we know it still has stigma, but as you, someone living with a mental illness, first of all, know that it's okay. It's not that you predetermined it. It's a condition that can be treated. There's treatment for it. You can live again another normal life and work and do things like any other person.
And be fruitful.
And actually be fruitful and contribute to the country.
Get married.
Yes.
Be
do the normal things. Enjoy the normal beauties of life that life has to offer. So apart from knowing that it's okay, I want you to know that there is treatment and support out there. It might not be too much yet, but there is treatment that you can take advantage of. Whether you have money or not, at least there is treatment somewhere that you can take use of it, that you can make use of it. The other thing is, if, for example, for people in that, because the country is quite big, for people, all regional referrals around, they're actually like, 18 now? They're quite a number all over the country. There is a point of care for mental health. So reach out to the hospitals where you are. For those who are in the central, of course, there is Butabika, which is our national. Unfortunately, the national referral is in Kampala. But for those Kampala and the neighboring districts, you can always come to Butabika and seek out for care. But also there are other organizations in the community that actually there to make sure mental health and people living with mental illness are given the care and support they deserve. So look around. Those who have like phones on the internet, there are other organizations. For example, Mental Health Uganda has a hotline that you can call. We have people in suicide prevention. There are hotlines online that you can reach out for. Butabika now has a hotline that you can call anytime. So really, if you know someone struggling with a mental illness, or you're struggling with one, or you're not sure and you would want to seek out for care and support, and for those who feel like the stigma cannot allow them to go in public settings and then move to a mental health unit, there are private hospitals now that have mental specialists, from psychiatrists, PCOs, clinical psychologists. You can always reach out and be like, okay, I want to go, for example, to Nakasero. There is a whole unit that they have specialists in there. So the specialists are now getting, at least we are now having a good number, that even in private practice, you cannot fail to get help.
To get one.
Even in government, you will not fail to get help, especially if you really need it. There is help. So seek out for help, because it will not go away just because you've decided to hide. It won't go away. Instead, it will lower your quality of living and then your chances of living better. Yeah.
Okay, so now as we are almost concluding, when it comes to policy, for you who's someone who is with the leaders in Parliament and you're supporting the Parliamentary Forum for Mental Health, what are some of the policies that you are seeing that should be passed out to cater for these people who are challenged with mental health related challenges?
The policies are still quite many, but at least the major urgent ones that really, really need to be put in place. One, I'll start from where I stopped with the integration of mental health, because now we want to unburden Butabika as the the national referral. It's too full to capacity, and all efforts, even with the organization, we told them that anyone that can put efforts together to make sure Butabika is decongested in any way, that would be good, because it used to be the only point of referral, but now if we want to support the system and unburden the whole ecosystem, we need to make sure that at the lower points of care, people can get support and treatment from there. So that's one of the biggest. And I'm grateful that government is already putting efforts to make sure there is the point of care, they're decentralized in different places. And then 2 is financing. I know it's getting better, but we are not yet there. Mental health still has a very small portion of the health budget or the whole national budget, yet it's one of now the biggest development issues that we have. So we actually urging government to make sure, and the leaders in different capacities, to make sure that efforts to better the mental health budget are put underway and also put into action. The other would be on the professional capacity. I mean, recruiting more health professionals in the system, but also encouraging people to take up these courses. We are still so few, I don't know. We still need more other clinical psychologists, more psychiatrists, more PCOs, more psychiatric nurses. So people should embrace the industry. We still need so many other professionals on board to actually help the burdened system already. Away from that, we still need, actually, one of the major efforts that, as the Uganda Parliamentary Forum on Mental Health that we are championing, we want so many people, as many as it can even be the entire country and across, that people are given the right information, that mental health literacy is championed, not only in institutions of learning, but even in the communities, in the workplaces. You asked about the workplaces. We need people, the employers, to embrace workplace cultures that have well-being at the center stage. Because without well-being of these people, chances are high that your productivity or your return on investment will be what you want. Somewhere, somehow, it's going to affect your productivity at the workplaces. So we call upon employers and leaders in these workplaces to make use of the professionals, to come and be part of their teams, to come and be part of their boards. You reach in a boardroom and there is no one in the well-being space, and I'm like, okay, how are you going to create a workplace culture that is inclusive, and there is no one, to give
this kind of technical support?
Yeah, technical support or advice as far as this is concerned. Because at that certain point, even if someone is a CEO, if they are going through a challenge that is affecting their mental health, they will not be able to perform. So yeah, we want people to have the right information and the right tools so that they can be able to support themselves, but also support those around them that are already being affected.
Okay, yes. It has been quite a good conversation that we've had here. So what are your last remarks as we are concluding the conversation today in regards to policy? My parting shots as far as policy or mental health policy is concerned is that we still have a long way to go, but at least we are not where I used to be. So with that, we call upon people in different capacities, from leaders to employers, to school heads, to anyone in the capacity of leadership and influence, to join efforts to make sure that wherever they are, whatever places that they have influence over, that mental health is prioritized, because it's real, it's here, and it needs the urgency that it deserves. Otherwise, it's going to deter a lot of development, and so many people will be affected in the long run, but also our country at large. Yeah. Okay. For someone who is watching us, as Nusra has concluded, we are calling upon you who is watching in the comment section. You can tell us some of the policies that you think we have left out, and you feel like they can be in position to support you as an individual who has a relative, you yourself who probably could be a probable candidate to get mental health related issues. Anyone who is watching, you can kindly, down in the comment section, share some of the policies that you think can make mental health services more affordable, more accessible, and more sustainable when it comes to supporting all of us in regards to mental health. As we are concluding today, we want to thank you for being good audiences, and kindly share this with everyone, because I believe when policies are passed, they are really meant to support us. So if you are currently watching, kindly share this with your friends, your relatives, anyone that you feel like this information is quite going to be enabling for them, so that they can get a glimpse of what we have shared. And we hope to see you in other episodes. I hope that you can subscribe, share, rate, tell us what is you think that we can share about when it comes to mental health. Thank you for watching. We've been here and we are going to be here in order to support you with things that have to do with mental health, as we have discussed today. Thank you and see you there.
Share, like, comment, and subscribe.
Okay, bye-bye.
Bye.